Shri Krishnavagishayatishwarabhyam Samprapta Chakrankana Bhashya Saram Shri Nutnarangendra Yatau Samarpitaswam Shri Krishnamaryam Guruvaryamide Virodhe Kartike Mase Shatatara Krutodayam Yoga Acharya Krishnamaryam Guruvaryamaham Bhaje Krishna Suri Dayapatram Jnana Vairagya Bhushanam Srimad Venkatanathaaryam Vandeham Yoga Deshikam Shri Gurubhyo Namaha. Namaskaram. In this session, continuing what we have been discussing of the KYM approach to adapting techniques for the purpose of individualized yoga therapy, we will focus on adaptations of postures specifically to help those seeking management or alleviation of neck and back pain. Now, at the outset, what I would like to re-emphasize is that what we will demonstrate today, myself along with my colleague, senior therapist Sai Kripa, what we will demonstrate in this session is not prescriptive but suggestive. In fact, very often those who have neck issues might have other issues. Those with back issues may or may not have neck issues but have other comorbidities. All of these need to be factored in when we teach an individual care seeker. Here we look at certain postures that are adapted specifically to address issues such as stiffness, mild pain in the neck or the back. Now, depending on the intensity, the postures can be further adapted to the requirements of the individual. Also here, I am selecting certain postures that we are very commonly using in the context of neck and back pain management. However, on a case-to-case basis, the same postures may be adapted differently by the consultant therapist after a thorough assessment of the needs and capabilities of the individual care seeker. Now, one of the very simple adaptations that we introduce to work on the neck, which also can be used as a technique to relax neck and shoulders even in those who may not specifically have neck pain, but for those who, for instance, work for extended hours on a computer where there is some element of neck tightness or strain involved, this adaptation may be used. Shitali pranayama classically is done without any movement of the neck. In the tradition of the Krishnamacharya Yoga Mandiram, a mild neck movement is introduced, as you will now see. One could sit on the floor in a comfortable cross-legged position alternately. Depending again on the capacity of the care seeker, one could sit on a chair or even lie down in a bed. If that is the capacity, then the movements have to be adapted to the lying position. Here I have requested Sai Kripa to show you these techniques seated on a chair. Sit comfortably. If you are using a chair, it is important to make sure the feet are firmly placed on the floor. Keep the chin tucked down. Inhale through the curled tongue, raising the head up. This head movement is introduced to relax the neck and shoulders. On the exhale, through the nose, lowering the head. Once again, inhale. Exhale, close the mouth, breathe out through the nose. Now, the same movement, Shitali is the pranayama technique, but we can give a little more focus to the neck or the spine by introducing a very gentle twist in this manner. So, the body turns slightly to one side, both the palms are placed on one knee. So, you see that there is a slight twist to the upper torso. In this position, Shitali can be done. Inhale through the tongue, head up. Exhale through the nose, lowering the head. Inhale. Exhale. The eyes remain closed throughout. The same may be repeated on the other side. Here, the number of repetitions depends on the requirement of the care seeker. Inhale. Exhale. Inhale. Exhale. One could do the left, right, return to the center as well. As I said, this is not a course or prescription but suggestion. Now, one other variant that we can give here is along with a gentle arm movement where the cupped palms are placed on the ice. So, this not only engages the shoulders and the elbows, it is also a way of relaxing the ice. So, that can be added to the Shitali technique itself. Inhale through the tongue, at the same time the palms are taken and placed to cover the eyes. On the exhale, lower the hands, the head also is lowered. Now, another option is to use a chant, a simple chant like Ma can be used not just in Shitali, in all the techniques as well, to lengthen the exhale and to work on improving the quality of the breath. Inhale Shitali, exhale Ma. One more time. So, you see here that the same basic technique can be developed in different ways depending on the purpose that it serves. We now look at a standing movement, a highly modified Bujangasana. Bujangasana is a prone position adapted to the standing using the wall support. We find that this is a posture that is very useful to stretch the spine. It's a very gentle supported spinal stretch, very effective that when we use it for people with neck or back related issues, of course with all due caution. One stands with the hands, the palms placed at shoulder level on a wall, feet slightly apart. In this position, on the inhale, gently arch the back, at the same time raising the neck up. Now, the degree of the arch would depend on the capacity of the student. On the exhale, breathing out, bend forward just partially, just a halfway bend to the extent possible. Inhale, come up, let the back arch, raising the head. So, you see the work it does on the neck, on the shoulder as well as the lower back. On the exhale, down. So, it is an adapted back arch and a forward bend sequence. On the inhale, one could straighten up. Now, here in this position, to work specifically on the neck, also on the shoulders where there is a lot of stiffness, a further adaptation, it is an adaptation of the Samasthiti arm movement or the Tadasana without raising the heels and using the support. You stand closer to the wall. On the inhale, gently slide the left hand up, the eyes follow the fingers. So, there is no independent neck movement, the neck moves depending on the movement of the eyes. On the exhale, lower the hand, eyes track the movement of the finger. On the other side, inhale, exhale, down. Now, the same may be also done with both hands. Again, the range to which the hands are raised depends on the capacity of the practitioner. Inhale, eyes to follow the fingers. Exhale, lower the hands, This is a very controlled movement where the independent neck movement is arrested, where there is tightness or pain. This is a supported movement where deliberately when you make the eyes follow the fingers, the speed of the neck movement will also slow down. So these are techniques that work well with neck, shoulder and back as well. We will now move on to an adaptation of the Chakravakasana, which is a kneeling posture, adapted to the standing position using the support of a stool. Palms placed on the surface of a chair or at the height of a dining table. The height is important, especially with those who have back pain. A deep forward bend might be contraindicated. So the range of the bend has to be adjusted depending on the comfort level of the student. Now here, palms placed on a firm surface without the surface moving. From this position, on the inhale, gently arch the back to the extent possible. Again, you see the work on the neck, shoulder and low back. On the exhale, gently return to the forward bending position. Highly adapted Chakravakasana, but very effective in its adaptation for yoga therapy. Inhale, exhale. This may also be done with the knees bent. In case the student is not able to do it with the knees straight, the knees can be bent as well. Inhale. This will limit the arch but is easier, less strain on the back. Exhale. Down. So if you notice, every posture is not a prescription. Again, there is a base modification, but from this, depending on the student concerned, we might increase or decrease the range of movement. Please come up. We now look at certain lying movements that are useful, specifically in the management of back pain, also neck related issues. When it comes to back pain, lying down with the knees bent is a good posture for rest when compared to Shavasana, where the legs are straight, because in Shavasana, especially for those who have a pronounced lordosis of the lower back, stretching of the legs may aggravate the tightness or discomfort. And we have observed that for some students, it might help to round the lower back and rest in this position. Another option is also to rest with a cushion placed beneath the knees if the legs are to be stretched. Now in this position, one very useful posture that one can adapt for back related issues is Dvipada gentle supported back arch, because the back is supported on the floor. Now again, I must point out that if someone is unable to lie down on the floor, or if there is strain sitting down getting up from the floor level, one could use a hard, firm, elevated surface, a higher cot with a firm surface. The same postures may be done in that position as well. Now Dvipada can be done with the arms by the sides. Inhale, raising the hips up and lowering the hips down. Classically, we hold the ankles. Here you see the adapted version where the hands are relaxed by the sides and there is a limited back arch. For those who experience pain, another simplification of the same posture, which will also support the back and prevent intensification of pain, is to go up, to raise the hips up on the exhale. Inhale there and then come down on the next exhale. This is gentler. When you use the breath acts as a cushion and supports the movement. So inhale in this position. As you breathe out, raise the hips up. This will reduce the range of the arch, at the same time it will protect the back. Inhale here and on the exhale, slowly lower the hips to the floor. So this is another variation. Now here in Dvipada, when we want to work on the shoulders, when we want to work on the neck as well, you could also change the arm positions. So the same posture can be done with the hands placed in 3 positions, as you will now see. Inhale in this position. Here you see the arms are at the sides of the body. And on the exhale, down. Now the arms can be moved further sideways. So you see that as the arms open out, there is also a corresponding opening out of the chest and the shoulders. Inhale and exhale down. And now the arms can be taken even further up. And so even more we work on the chest opening. Shoulders also, where there is a tendency for the shoulders to round towards the front, when we change the position of the shoulders in such a back arch, it alters the effect because it opens out, it broadens the shoulders as well. Inhale and exhale down. These are some modifications that we use in Dvipada Pitham. Again, the range of movement depends on the practitioner who is doing it. Now bring the arms to the center, just take a few breaths. It is important always to remember when we plan courses that we don't juxtapose a back arch and a twist together, because the postures work in different directions. And so what I am showing you here is not a course plan that is to be followed in this order, but they are a collection of postures that are used. In general, if a back arch is used, it is important to counter it with some simple forward bend before proceeding to a twist. We will look at one such forward bend now, Apanasana. Here, Kripa is going to show you the one leg Apanasana, Ekapada Apanasana, with a variation where we engage the shoulders as well. So, in this position, the one leg is bent, foot is placed on the floor, the left foot is raised, the knee is bent. Inhale here. On the exhale, draw the left knee towards the chest. At the same time, sliding the left palm all the way down to the thigh, to the base of the thigh, so that there is a relaxation of the shoulder. Inhale. Slide the palm above, up the knee. On the exhale, draw the knee towards the chest, at the same time sliding the palm down to the base of the thigh. Inhale, out, and so on. You can now keep that leg down, and we will show you on the other side as well. In this position, inhale. Exhale, draw the knee inwards gently. You see that as she slides the palm down, there is a relaxation of the shoulder. Inhale and exhale. This is a very useful posture. You see it working on multiple dimensions. It can be used to work on the knee. It can be adapted to work on the ankles. It can also work on the neck and the lower back as a forward bend. In the lying posture, it's a very gentle posture that can work on calming, on alleviating back pain and also neck related issues. Okay, keep the foot down. We will now look at Jatara Parivriti. Here, this is a highly adapted Jatara Parivriti. In the classical form, as we are taught in the tradition of Krishnamacharya, the classical Jatara Parivriti requires one to be lying straight. The legs are raised vertically up and then brought as a twist to one side with the head turned to the other side. It is a very intense static twist. It requires considerable flexibility and strength of both the neck and the back. Now, Jatara Parivriti classically cannot be used for those who suffer from neck or back issues, but adapted versions can. Here, the intensity of the twist is reduced, the form is altered, the function is retained but made much milder. So, here you will see this adapted Jatara Parivriti. Knees are bent, the hands are taken to the shoulder level, the palms face downwards. Inhale in the center. On the exhale, twist the legs towards the left. At the same time, the head is turned to the right. Now, the head movement is optional. If there is pain, then you refrain from using the head movement. But otherwise, the turning of the head to one side, the legs to the other side is a very gentle but effective way of working on the entire spine from the cervical to the lumbar region. Inhale to the center, exhale to the other side. Inhale center, exhale twist, inhale to the center, exhale twist to the other side. Now come back to the center. Here I will request Kripa to show you the same movement, how it may be done in a graded series. Often when it comes to therapy, we find that even simple movements such as these can be painful or difficult for the individual practicing them. And so instead of going to the full range of the twist, the same twist can be done step by step. We will show you 3 steps. Inhale, center, exhale, twist gently. Also the neck movement is controlled, just a mild turn. Inhale, center, exhale to the other side, very slight turn of the head. Inhale, center. Now the next time the range is slightly increased, exhale. The legs twist more, the head also turns a little more. Inhale, center. Exhale to the other side. Again, slight difference from the first repetition. Inhale, center. Now the third time one could go to the complete range. Exhale, twist. Inhale, center, and twist to the other side on the exhale. Return to the center on the inhale. Exhale, lower the arms. This again becomes a very good rest position. Even these graded movements can be introduced in a single session or progressively depending on the comfort level of the student. Now when it comes to back pain specifically, there is always this question, do we work with back arches or do we work with forward bends? And it is impossible to say this or that for the simple reason that different people experience low back pain differently. And for some, the forward movement may be uncomfortable. For others, it might be the back arch that is uncomfortable. And so there is the need to very judiciously observe and see what can be used and what can be used perhaps later, depending on that particular individual. And so in that context, based on this one can develop. You can work with Bujangasana, you could work with Shalabhasana, subject to the capacity. Now here I would like to show you just one technique in the prone position used to strengthen the back. Once pain has been reduced, a simple movement in the lying supine position where the leg is raised. The raising of the leg is a way of strengthening the muscles of the lower back. When it comes to back pain, back related issues, the first focus is shamanam, pacification of the pain, improving the flexibility of the back. When that has been achieved, then we move towards shodhanam, which is strengthening of the back muscles. Here the prone postures can be very useful. Bujangasana, Shalabhasana are known to be helpful for working on back strength. Again, has to be taught depending on the capacity and comfort level of the individual care seeker. Here I show you an adaptation of Shalabhasana where one leg is raised and lowered at a time along with the breath to work on strengthening the low back muscles. In this position, with the forehead resting on the floor, arms are by the sides, shoulders relaxed, Inhale, one leg is lifted gently to the extent possible. Exhale, lowered. Inhale, the other leg is lifted. Exhale, down. Ideally lifted without bending the knee. We will see this one more time. Inhale to the extent possible for each care seeker. Exhale, down, and on inhale, up. Exhale, down. So, you see this very controlled leg lift will work on the region of the low back to strengthen the low back muscles. Then always when a prone posture is done, the counter posture has to be done in the supine position, and a very good counter posture in general to support the back, to relax the back muscles, is to lie supine with the legs raised, which we will just quickly show you. Here you see in the supine position, Kripa has raised her legs up, placing the feet on a stool. The height of the stool is about 1 foot, at the most 1.5 feet high. The shoulders are relaxed, arms by the sides, palms open. The knees rest comfortably on the edge of the stool. This position relaxes the low back because the back is completely at rest, and so is a very useful posture to relax the back and also for restorative breathing. In this position, one can work with different techniques of breathing, specifically working on lengthening the exhale, because a longer exhale contributes to improved muscle relaxation. There is a sense of lightness that is felt with the long exhale. One could also integrate chanting, as we saw in Sheetali. Inhale and then chant on the exhale. These are different techniques that can also be brought into the lying position where the legs are raised for the specific purpose of relaxing the neck and the back. Now here what we have seen are certain techniques suggestive of how certain postures may be adapted for individuals with neck and back related issues. As I have mentioned repeatedly, by no means are these conclusive or prescriptive, and it is essential that postures such as these are adapted to the individual and learnt and practiced under the guidance of a competent yoga therapist. Thank you so much for being with us and watching this session where I have presented along with my colleague Sai Kripa the adaptations of asana as followed in the tradition of Krishnamacharya and TKV Desikachar. Thank you.